This presentation is regarding community health and an evaluation of health grant opportunities. My name is ESkehan, and I am a DNP student at Fort Hays State University in Hays, Kansas. While exploring for a healthcare grant opportunity that's applicable to my project, I just want to go over a few things about my project. My project focus is to promote physiologic birth and reduce cesarean delivery rates. The focus is also at an acute care facility in suburban New York. Although we are not in a rural area, the South Shore of Long Island has a significant underserved population. A little bit about the background and significance of the problem. Home births were very common until the 1920s when they moved into the hospital setting. In 2018, 1 in 3 women have a cesarean birth in the United States. It's the most common surgical procedure in the United States. The increased cesarean birth rate has led to no significant improvement in outcomes, and overuse adversely affects maternal and neonatal outcomes. Cesarean deliveries attribute to over half of the expenditures in childbirth. An increased length of stay equals an increased healthcare spending. Provided challenges include maternal comorbidities, advancements in technology, overinterpretation of data, inexperience, presence of a residency program, competing pressures, and medical legal influence on their practice. The nursing challenges include the last 100 years using a medical model, as I mentioned before, birth moving into the hospital setting, increased acuity, competing priorities, increased use of electronic medical records, patient expectations, high use of regional analgesia, and also lack of knowledge regarding physiological needs of the patient. The consumer challenges include that they willingly accept obstetrical interventions such as electronic fetal monitoring, elective inductions, pain management, and operative birth, lack of continuous labor support, high use of regional analgesia, which prevents free movement and ambulation and also increases the risk for an operative delivery. Also, they tend to surrender their autonomy. The subject area is maternal child health, and there are many initiatives at many different levels. At the organizational level, it's at the project hospital. At the professional level, there's ACOG and AWHONN. At the state level, there's the Safe Motherhood Initiative in New York, and in California, the California Maternal Quality Care Collaborative. At the national level, it's the Centers for Disease Control, and at the global level, it's the World Health Organization. The Association of Women's Health, Obstetric, and Neonatal Nursing Organization, also known as AWHONN, provides research grants designed primarily for nursing researchers whose efforts are on the beginning development of a program of research. Studies that are clinically focused and outcome-based are a priority. Projects that focus on the nurse's role in delivering cost-effective care in these subspecialties are encouraged and will also be considered. Over $37,000 has been awarded already this year. Awards are granted to researchers whose proposals investigate variables relevant to AWHONN's 2019 to 2024 research priorities. Priority 1. This priority addresses clinical practices that relate to areas of greatest need for women, newborns, and families, and for which they believe AWHONN-supported research can have the largest impact. The number 1 priority is improving maternal and newborn outcomes by supporting normal physiologic birth, which is my project. Although the national cesarean birth rate is around 32%, the area of focus for my DNP project is the South Shore of Long Island, just outside of New York City. The cesarean birth rate in that area ranges from 38.5 to 43.1. As you can see, there's a lot of work to be done. The DNP project highlights elements from the California Maternal Quality Care Collaborative toolkit to support vaginal birth and reduce primary cesareans. It involves providing education for labor and delivery nurses and prenatal education for pregnant women to support vaginal birth and reduce cesarean birth rates in full-term women with a singleton pregnancy in the vertex position, which are also known as low-risk pregnant women. It also focuses on the clinical aspects to improve outcomes for primiparous women and their infants and children, and the costs are minimal. The funds would be utilized for the following. The prenatal education costs include printing business cards with a QR code for access to YouTube videos, one in English, one in Spanish, and they are printed on either side of the business card. It's approximately $40 for 1,000 cards. The nursing education is being made available through an organizational educational portal called HealthStream. One of the tools for supporting vaginal birth is a peanut ball, which costs about $15 each. 2 sizes are most used, and the facility has 6 labor rooms for a total of $180 to supply each birthing room with 2 different sized peanut balls. Last, I will discuss the timeline. The application deadline. The application opened on September 21, 2020, and will close on December 11, 2020 at 8 p.m. Eastern Time. The award date. Final IRB approval or exemption due date is April 1, 2021 at 8 p.m. Eastern Time. The funding period runs from May-June 2021 to May-June 2022, which is 1 year. Thank you for taking the time to watch my presentation. These are my references, and please have a great day.